Top 20 Clinic Nurse Interview Questions and Answers. Whether you just graduated and are hunting for a job, or you are an experienced nurse seeking a better workplace, an interview requires serious preparation. The good news is that you can find interview questions that are commonly asked during a clinic nurse interview. Luckily, we have done the legwork for you. Here are the top 20 clinic nurse interview questions along with answers. 1. Tell me about yourself. This is typically the first question in many job interviews. The interview manager seeks to know your experience, work, qualities, and accomplishments. Sample answer. I am a nurse at the JBL Medical Clinic. I have served in this facility for the last 4 years. With a BSc in nursing, I have performed my roles with professionalism and to the satisfaction of both the patients and my employer. Being self-motivated and passionate about helping others keeps me inspired to do my best to achieve desired and positive outcomes. I have contributed significantly towards offering quality nursing care that makes the clinic one of the best in the region. 2. Why did you pursue nursing as a career? The interviewer wants to hear what motivated you to choose nursing as your career. Sample answer. Throughout my life, I've always loved to help others. Some years back, I used to be very happy when I volunteered to support the old and sick. Nursing was definitely a natural path for me because it combines my love for science and passion for helping others. By pursuing nursing as a career, I was sure that it would perfectly fit my interest and desire to help people. 3. What is most rewarding about being a clinic nurse? The aim of asking this question is to test whether you are satisfied with your work and if you are eager to serve others. Sample answer. As a clinic nurse, I am thrilled to serve both the young and old. I have witnessed how strong the young can be amidst life-threatening conditions. The bravery I see in my patients inspires me a lot. It provokes me to face my challenges with optimism and be hopeful that the challenges I encounter today are short-lived. 4. Where do you see yourself in 5 years? The interview manager seeks to know your personal ambitions in nursing and also assess whether the direction you intend to take will be beneficial to their facility. Sample answer. In 5 years, I hope to continue offering quality nursing care. I expect to be more skilled and experienced in the field. Moreover, I intend to pursue a short course in management. That way, I will be able to handle managerial and more administrative duties. 5. Why are you interested in working at this clinic? The interviewer wants to know why you want to work at the clinic. Sample answer. Your medical facility is well known for offering quality health services to its clientele. I am also aware that you work with some of the best physicians. Besides, you provide a good working environment for nurses and other workers. Thus, working here will enable me to be the best I can and grow in the profession as well. 6. What is your greatest weakness as a clinic nurse? The interviewer wants to hear whether you have a huge weakness that may limit your productivity. Sample answer. When I started practicing as a nurse, I used to get overly involved with patients under my care. As a nurse who is passionate about caring for patients, I couldn't watch them suffer. But after realizing it and discovering it's interfering with my service, I learned to make patients comfortable without compromising my duties. 7. Describe your interactions with other nurses and doctors. Here, the interviewer wants to assess whether you get along well with others. Sample answer. I work effectively when I'm part of a team. I am easy to work with and not burdensome or too demanding. Besides, I maintain professionalism when working with others. 8. What is most challenging about being a clinic nurse? This question is asked with the aim of determining whether you can handle the challenges you encounter at work. Sample answer. I find it very tough to see a patient suffer. At times, patients come with excruciating conditions. Other times, the kind of procedures they undergo are very painful. But as a nurse, I always remain positive that they will get over the suffering. Besides, I offer the best care possible to make them comfortable and perhaps ease their pain. 9. What do you do when a patient is unsatisfied with your care? Your ability to handle complaints from unhappy patients is tested using this question. Sample answer. I listen to the patient to understand their complaint and then try to resolve it. Besides, I continue to offer nursing care with professionalism and courtesy. If the complaint or matter at hand is beyond my ability, I report to the relevant office for action. If a patient makes unreasonable demands, I remain firm and let them know the boundaries of my job. 10. How does a typical working day of a clinic nurse look like? Here, the interviewer wants to test your familiarity with the daily duties performed by a clinic nurse. Sample answer. A clinic nurse assists doctors, delivers patient care, monitors vital signs, administers treatments, and performs tests on patients. Other duties include recording patient behavior, handling medical emergencies, preparing patient documentation, and scheduling patient appointments. 11. If family members of your patient ask for your personal diagnosis, how would you respond? By asking this question, the interview manager seeks to assess whether you know your boundaries and how you would respond. Sample answer. Unless diagnosing is one of my roles, I wouldn't do so. However, I would try to know why the family was asking for a personal diagnosis. Could it be the doctor didn't explain the prognosis? I would make sure to share information while maintaining my boundaries. 12. How do you deal with stress from your job? The interviewer wants to hear how you deal with stress. Sample answer. Stress is inevitable in my career. Sometimes I'm stressed by some life-threatening cases I handle or unexplainable death cases. When it happens, I make sure to engage in some workouts after work. I have found out that exercise helps me to take away stress. 13. How do you deal with a rude doctor? This question can show whether you have a bad attitude or are a complainer. Sample answer. I am not bothered by a one-time rudeness incident, as even doctors have bad days. But if it occurs repeatedly, that would mean something different. It could be likely that the doctor is dissatisfied with my work. In that case, I would reach out to the nurse manager for advice and help. 14. What qualities should a good nurse have? Using this question, the interviewer wants to evaluate your understanding regarding qualities that a nurse should have to be successful. Sample answer. A good nurse should be caring to assist patients in their most scary and vulnerable times. The nurse should have good communication skills to communicate effectively with other people, including patients, families, and physicians. Also, he or she should have empathy, be attentive to detail, a problem solver, and self-motivated. 15. As a clinic nurse, what is your greatest skill? This question offers an opportunity to describe what makes you unique from other candidates. Sample answer. I possess a variety of skills that enable me to perform effectively. My greatest one is the ability to listen to patients. It can be frustrating for a patient or any person to realize they are not being heard. But through experience, I have learned that listening to patients helps to make them comfortable and have peace of mind. Through listening, I understand their needs and concerns. That enables me to offer appropriate service and care. 16. Why do you want to leave your current job? The interviewer wants to know why you are unsatisfied with your current position. Sample answer. There are no more learning or growth opportunities in my current workplace. I am looking for opportunities to grow in my career. Besides, I feel that I'm ready to face new challenges. I'm certain that I'll find an opportunity to expand my expertise here. 17. Have you dealt with a difficult patient? How did you handle the situation? This question is aimed at assessing your ability to handle difficult patients. Sample answer. A year ago, I had an elderly patient who was very argumentative. He would get angry very fast for little things, such as room temperature. But I did my best to understand him. I used to talk to him often to know whether he had any new needs or concerns. 18. What is your definition of a good working environment? The interview manager wants to hear whether you will be comfortable in the kind of setting they offer. Sample answer. A good working environment is a workplace that is peaceful, secure, and one that promotes productivity. Also, it motivates employees to come to work. I understand that different health facilities have different working environments. Thus, I can adjust accordingly. 19. How do you manage a lot of workload? This question aims to test your ability to prioritize work and finish your workload on time. Sample answer. I manage my workload by prioritizing tasks. I identify urgent and important tasks and ensure to work on them and finish them on time. Tasks that are least urgent and important come last. Prioritizing helps me to attend to all cases based on their urgency and importance. 20. How do you stay current regarding developments and trends in your profession? Here, the interviewer wants to know whether you stay informed about developments in nursing. Sample answer. I am a member of the Registered Nurses Association. Through it, I receive updates and news about happenings in the profession. I also catch up with the latest development in the field through nurses' social network groups. Conclusion. Do your best to study and practice these interview questions and answers to be adequately prepared for your clinic nurse interview. Ensure to tailor them to suit your company, academic attainment, and experience.